Good morning everybody. I am Dr. Reshma Anand, consulting eye surgeon at Nakshatra Eye Care. Today I will tell you a few things, rather clarify a few doubts regarding cataract. What is cataract? Cataracts are a clouding of the lens in the eye, resulting in changes to your vision. A cataract can develop in one eye at a time or both eyes simultaneously. The lens of the eye consists of normally clear tissue that focuses light onto the retina. What is retina? A layer of nerve cells lining the back wall of the inside of the eye. In retina, the light is converted to nerve signals that communicate information to the brain. That's how you can see an object. While cataracts are considered a disorder and often benefit from treatment, they are also a common and even normal part of aging. Like you get gray hair with age, similarly you get cataract with age. By age 80, more than one half of all people in India will develop at least one cataract according to National Eye Institute. While most cataracts are related to aging, there are also certain types that can develop during childhood or due to surgery, due to some injury, use of certain drugs or other health problems. Cataracts tend to grow progressively worse, causing vision impairment. This vision impairment may interfere with your daily activities. A number of factors can increase your risk of developing cataracts, including older age, family history of cataract. For example, if parents have cataract, there is a higher chance of development of cataract in the children also. Greater exposure to sunlight, living at higher altitude, diabetes, high blood pressure, history of any injury to the eye, or some history of inflammation or surgery. Even radiation treatment on the upper part of the body for some other ailment like tumors can lead to the development, can increase the risk of development of the cataract. Smoking, drinking alcohol in excess, long-term use of some medication like steroids can cause cataract. While most cataracts are related to aging, some people are born with cataracts or develop them during childhood. These are known as congenital cataracts. Congenital means by birth. Sometimes congenital cataracts have genetic causes or they may be due to some injury or infection in the uterus itself. Conditions that can cause them include myotonic dystrophy, that is a type of muscular dystrophy, galactosemia, a rare metabolic disorder, then neurofibromatosis, type 2, a disorder in which tumor grows on nerves, rubella, sometimes also called as German measles, toxoplasmosis, a parasitic infection, cytomegalovirus, a viral infection, then syphilis, herpes simplex, all these viral infections are the causes. Cataracts can be broadly divided into 4 groups based on their causes. Age-related cataract, this group accounts for large majority of cataracts. Then congenital cataracts, cataracts in babies, children can be caused by a number of different factors. Secondary cataracts, these are cataracts in adults which develop due to some other diseases in the eye or some systemic diseases like diabetes or by drugs such as steroids. Traumatic cataract, an injury to one or both eyes may result in cataract. This can happen soon after the injury or several years later. Cataract can also be categorized based on the area of the lens they affect. There are 3 types of cataracts based on location. Nuclear cataracts, This type of cataracts affect the center of the lens. It tends to cause yellowing and clouding of the area. Cortical cataract. This type of cataract affects the edges of your lens. It tends to cause white marks and streaks that gradually extend to the center of the lens. Posterior subcapsular cataracts. This type of cataracts affects the back of your lens. It tends to cause an initially small opaque area in the path of the vision and often progresses faster than other type of cataract. The most common initial symptom of cataract is a small area of blurred vision. Over time, this area of blurred vision is likely to grow as your lens becomes more clouded. Eventually, one may get the sense that overall vision is dull or blurry. Along with vision that gets progressively blurrier, one may also experience color changes in the lens that causes everything you look at to take on a yellowish or blackish or brownish cast. Eventually, one may have trouble distinguishing colors, particularly shades of blue and purple, as well as performing tasks that requires distinguishing colors, including reading. Cataracts are generally diagnosed by an eye doctor, an optometrist or ophthalmologist using a variety of eye and vision tests. Visual acuity test will be done in which one attempts to read the letters on an eye chart, slit lamp test to see the structures in front of the eye, as well as tonometry to measure the pressure within the eye will be done, and a dilated eye examination in which drops are placed in the eyes to make your pupils widen so the doctor can see into the interiors of your eyes more easily. Surgery to replace the lens in the eye with an artificial lens is the only way to remedy a cataract, but it's rarely necessary to have surgery immediately upon being diagnosed with a cataract. The decision to have surgery depends on general health and how much cataract or cataracts are interfering with the daily life. If you are still able to drive or use public transportation, read and perform the task you need to do in your home or workplace, you may decide to wait to have surgery. Once you decide to go ahead with surgery, you should discuss what to expect with your doctor so you know how long you will likely be at the hospital, what kind of symptoms are normal after surgery, and what kind of help or care from others you may need afterwards. Surgery, again, after surgery, the doctor will replace the lens with the artificial lens, which are of various types, which you can discuss with your doctor. That's all about cataract. Thank you so much.